Let's talk about HRV. Why is it important and how can you improve it? So, your heart rate variability is the variation in time between consecutive heartbeats measured in milliseconds, and it's a direct reflection of your autonomic nervous system, ANS, activity. So it's basically a reflection of your fight or flight or rest and digest response. Your ANS helps you respond to daily stressors, and it regulates bodily systems such as heart rate, respiration, and digestion. And your HRV gives you insight of the balance between these two systems, so between your parasympathetic and your sympathetic. And your HRV is a health indicator that provides powerful insight. A higher HRV is associated with better overall health as well as cardiovascular health, lower stress, and more resilience. This because a higher HRV increases flexibility and adaptability of the nervous system, resulting in greater parasympathetic activity, which supports relaxation and recovery. A lower HRV, however, may indicate being stuck in a fight or flight response, which is stress, or that you live a less healthy lifestyle or other health issues such as trauma or illness. So what are the benefits of a higher HRV? Well, because your HRV is influenced by your breathing behavior and can reflect blood pressure regulation, it can therefore also improve your blood pressure, along with the other benefits of a flexible and adaptable nervous system. So how does breathing come into the picture? Well, because when your heart and when your breath is in coherence, the heart rhythm and the breath pattern is synchronized, and that promotes harmony between heart, brain, and emotion. And achieving this coherence promotes parasympathetic nervous system activity and enhances stress management and emotional balance and cognitive function. So there are some HRV factors that are in versus out of your control. But remember, it's a highly individual measure. You should only really compare yourself with your own value over time. And factors that impact your HRV are age, gender, genetics, hormonal cycles, work and family stress, lifestyle habits, and living environment. And some of these things you cannot control. However, the things you can control is sleep hygiene, nutrition, physical fitness, and stress management, which can be controlled with conscious breathing. And that in turn improves your mental health and stress resilience. So how are you supposed to breathe yourself to a better HRV? Well, among the many other benefits of conscious breathing, it promotes nervous system regulation. Conscious, gentle, slow, and expansive breaths through your nose optimizes this regulation. And the optimal rate for heart and breath coherence sits at 6 breaths per minute. And spending time here will improve not only your HRV, but your overall well-being. So let me talk you through some HRV optimizing breathing techniques. First one. Practice inhaling for 5 seconds and then exhaling for 5 seconds. This pattern means that you are breathing 6 breaths per minute, and try this every day for 5 to 10 minutes. Another technique is flow breathing at a 1:2 ratio, meaning a prolonged exhale. So inhale for 3 seconds, exhale for 6 seconds, etc. Another breathing technique is box breathing, where you inhale for 4 seconds, pause at the top for 4 seconds, exhale for 4 seconds, and then hold on empty for 4 seconds. And stay with this breathing pattern for 5 to 10 minutes. So how can you track your HRV? Well, most smartwatches tracks your HRV. And keep in mind that physiological improvements take a long time, and habits can take a long time to form before you see the results. So small habits stacked on top of each other are more sustainable than major lifestyle changes all in one. And being aware of your HRV and having agency of what you can do to control it makes it a powerful tool that offers great insights to your overall health. And here you'll see a visualization of my HRV over the last 6 months as it's been tracked by my Oura Ring. And as you can see, my HRV has been pretty stable over time over the last 8 months. And you can see it's not completely linear. There are some peaks and some dips, and they are a reflection of my life circumstances at the time. So some factors that I have noticed greatly impact my HRV are nights of poor sleep and alcohol consumption. And this is even just a glass of wine with dinner. Having a late dinner past like 7 or 8 p.m. also impacts my HRV, and not sticking to my usual exercise routine. So I think that the HRV is a really cool measurement to track, and having the awareness of this makes it so much easier to make choices that impact my health positively.